Hello, I'm Dr. Pamela Ruegg. I hold the David J. Ellis Chair in Antimicrobial Resistance and Large Animal Clinical Sciences at Michigan State University. And today, as part of our continuing series of antibiotic usage on dairy farms, we're going to take a little detour away from the cows and briefly discuss how antibiotics are used in calves. Now, consumers are mostly concerned about antibiotic usage in cows because they're concerned about the perceived risks of those uses in the milk and the meat that's produced. It's important for us to recognize that usage of antibiotics in female dairy calves is pretty low risk. It takes 2 years to raise a calf, and for most of those 2 years, from the time the calf is born until they start producing meat and milk, they're at low risk of disease. In fact, data has shown that the greatest risk of disease in these growing calves is just the first 60 days of life. In other words, out of that first 2 years that animal is growing, only about 8% of the time, the first 45 to 60 days of life when they're still on milk, are they at significant risk of contracting a disease that's caused by bacteria and requires an antibiotic treatment. Now, during that period, there's 2 diseases that are most significant in the baby calves, and that's diarrhea and pneumonia. They're the primary bacterial diseases of calves. And we've got some pretty good national level data from the National Animal Health Monitoring Service that shows how antibiotics are used. In fact, if we take a look at the graph, you'll see the vertical axis is the percentage of calves treated with antibiotics. And I've taken this data out of the Dairy 2014 survey and shown that among the pre-weaned calves, that high-risk group, about 16% of them nationally receive antibiotics for treatment of diarrhea, and about 11% receive antibiotics for treatment of respiratory diseases. Far less than 5% of the calves, both the pre-weaned and the weaned, have received antibiotic treatments for any other disease throughout that growing period. So that's good news. Most calves are healthy most of the time. Now, while there's only a few bacterial diseases that most calves are treated for, there's actually more antibiotics that are approved for use to treat calves than there are to treat those lactating cows. In comparison to about the 5 injectable antibiotics that are approved for lactating cows, there's actually 10 approved antimicrobials to treat calves. The thing I want to point out is, of those 10 approved antibiotics, 5 are in classes that include drugs that are medically important for treatment of human diseases. So the take-home point here is we want to make sure we're working with local vets to have evidence-based treatment protocols and use those medically important drugs only when necessary. Now, that NAHMS data shows national level percentages, but we've also done some research on farms in our region to collect data on the number of doses of antimicrobials used on various farms to treat pre-weaned calves. And I want to stress that this data shows doses, defined daily doses per pre-weaned calf, only for pre-weaned calves, not for those growing heifers. So this is for the highest risk group. And on the chart you'll see here, the vertical axis is the number of defined daily doses per pre-weaned calf per year. If you need a refresher on what a defined daily dose is, go back and look at video 9 where we discuss that usage in adult cows. When you take a look at the data, this data shows the number of doses per pre-weaned calf for 35 Wisconsin dairy farms. What you'll see, first of all, I think, is really obvious that there's a lot of variability among farms. The least using farms are using almost no doses, and the highest using farms are using up to 50 defined daily doses per pre-weaned calf. You'll also notice that most of the treatments are just like the NAHMS data for treatment of diarrhea or respiratory disease, and only 4 of those farms used any preventive treatments at all. I think the take home on this slide is the large variability in usage shows that some farms have clear opportunities to improve calf health and reduce antibiotic usage by working to prevent bacterial diseases in calves. It's important that we identify those farms and work to improve the health. All right, let's recap in our little detour about antibiotic usage in dairy calves. The greatest risk period for bacterial diseases in dairy calves is a small portion of their overall life. It's those first 60 days during the pre-weaning period. During that period, we need to work to prevent diarrhea and respiratory diseases, and when they occur, you need to be working with your local veterinarian to have evidence-based treatment protocols that use approved antimicrobials only when necessary to maintain the health of those animals. While there's more choices of antibiotics that are available to treat this age group, it's important that the type of antibiotic chosen aligns with the type of disease and minimizes use of the critically important, medically important antimicrobials that we share with human medicine. So overall, we see a lot of variability among farms, which means we have an opportunity on some farms to improve management, prevent disease, improve welfare in calf, and reduce the overall need for antibiotic usage in this group of dairy calves.